Hello, my name is Nurse Pauline RN. Welcome to my channel. The title of my video today is on eating disorder, and I will be talking today about bulimia nervosa. Please hit the like button, thumbs up, please subscribe, please share this video. I will be doing questions and answers which are taken directly from RN Nclex examinations. My first question. Client is admitted seeing things that others do not see. Restlessness, dry mucosa. Which most likely causes the symptoms? The correct answer: 1. Vomiting leads to dehydration and electrolyte imbalance. 2. Hallucinations, restlessness can be a sign of electrolyte imbalance. 3. Dry mucosa is related to dehydration. Number 2, for bulimia, what antidepressant would the doctor be prescribing for bulimia nervosa? The correct answer is Clexia. Citalopram, Citalopram, Clexia, a selective serotonin receptor inhibitor. It's a SSRI, a selective serotonin receptor inhibitor. This is an antidepressant for bulimia nervosa. What would be your nursing intervention for patient diagnosed with bulimia? Correct answers: teaching, avoid urge to purge after discharge. Hold mandatory group meetings after mealtime to assist exploration of feelings after mealtime. Always observe your patients 1 to 2 hours after meals. Patient may be having feelings to purge after meals. Client do binge after eating. Client do binge eating. Client do binge eating. They have feelings to purge after meals. That's your correct intervention. Watch your patient 1 to 2 hours after eating. Follow them to the bathroom. You have to follow them because they do binge eating and induce self-vomiting. So you have to follow them to the bathroom. You can hold mandatory group meetings after mealtime for them to explore their feelings. Our next question. Client is diagnosed with bulimia, suspected of self-induced vomiting. What should the nurse do? The correct answer is the nurse should accompany the patient to the bathroom. What is the age range of bulimia nervosa? The ages are from ages 18 to 22 years old. Our next question is, client diagnosed with eating disorder. Nursing diagnosis is low self-esteem. What would be your nurse's intervention? Your correct answer: offer independent decision-making opportunities to improve self-esteem. Client with eating disorders diagnosed with low self-esteem, nursing intervention would be to offer independent decision-making opportunities to improve self-esteem. Our next question: using behavioral modifications for eating disorders, which intervention would be most likely produce positive results? Your correct answer is for positive results. The client should perceive they are in control of clearly communicated treatment. This is accomplished by contracts with client for privileges based on weight gain. We're gonna have meetings with the families for patients who are diagnosed with eating disorders in an inpatient psych unit. And these are questions in regards to family members canceling family therapy with the patient. What are the reasons that families cancel family therapy with patients with eating disorders? That's the question. I'm going to give you a few answers, which are the correct answers. 1. Family cannot deal with social stigma of client having emotional problems. 2. Family stigma may discourage compliance with therapy. 3. Family feel guilt, avoid dealing with guilt. 4. Family feel as if they contributed to this disorder, they may do a no-show. 5. Dysfunctional family fears conflicts that could surface during sessions, and these are about reasons why families cancels family therapies for patients with anorexia nervosa. They cannot attend meetings because they fear social stigmas. They feel guilt. They feel as if they contributed to the patient being anorexic, and they are afraid of being in family therapy because they do not know which other conflicts that would come to the surface during family sessions. So they would prefer doing a no-show. For eating disorders, question: nurse teaches about factors that influences eating patterns. Your correct answer: environmental, taste, textures, temperatures of meals, stress. These are factors that influences eating disorders. What affects appetite and eating behavior? This is another question. And this answer is functions of GI structure and function. The next question is, which individual would be at highest risk for obesity? And the correct answer is clients from among lower socioeconomic classes. Remember, for obesity, BMI is greater than 30. BMI 20 to 30, that's ideal. For questions about eating disorders, assess for BMI of 35 would be what? If you assess your patient and your patient has a BMI of 35, this is an obese patient because the BMI is greater than 30. This patient would be at risk for, correct answer is, workload of the lungs is increased, respiratory insufficiency, hyperlipidemia, high intake of fatty foods, high cholesterol, high triglycerides. These are your correct answers for patient greater than 30 BMI. In this case, the patient's BMI is 35. Our next question is, what is the definition of cachexia? CACHEXIA. Wasting, weakness of the body. Physiological needs take priority over physiological needs because it is life-threatening. Cachexia, which is starvation, is wasting, weakness of the body. This is life-threatening. Okay. This ends our video on eating disorders, anorexia, and bulimia. Have a good day. Thanks for listening in. Stay blessed. Take care.